Desert Oasis Healthcare has sponsored this segment. I'm pleased to welcome their representative, Melissa Diaz, to talk about Medicare enrollment. It's open enrollment time, and you're here to guide people from this sometimes confusing and difficult process.
Absolutely. It can be such an overwhelming process for people. Right now it's open enrollment or annual enrollment, so people that are on Medicare have the chance to look at different plans, what's being offered for the following year. So we really try to help the community, guide people, help them select the plan that's going to be best for them. There's a lot of things that they have to consider when selecting a Medicare Advantage or Medicare plan.
All right, so talk about the difference between Medicare and Medicare Advantage and what you should consider before making your choice.
Well, really cost is probably the most consideration. Medicare Advantage offers you a great comprehensive plan, but for a lot less money every month. It's just your Medicare Part B premium. There's no additional premiums. Where with traditional Medicare, you have to purchase a supplement, a Part D drug plan. It can start to get expensive, and those supplemental plans actually raise every year. So Medicare Advantage is a great option for people to think about, especially, if finances are a consideration.
Well, and for many people they are, obviously, and we all want to save money. We'd rather not spend more on our health care.
Who doesn't want to save money?
So there are a variety of choices. I think some people like me, who are still about 10 years away from getting onto Medicare, we think, okay, well then you just sign up and you're good and you're done. But there are a number of choices that you have to be aware of.
There are many things to consider, and a lot of people are working past 65. So they don't actually, they get bombarded right when they turn 65, but then after that, they don't have any direction. So we do monthly classes at Desert Oasis Healthcare that help people to navigate that system, help them sign up, get their Part A, their Part B, get everything all situated, and then, we can help them, whichever trajectory they decide to go on.
I know it can be confusing. It's confusing just with, selecting healthcare plans in the private world.
Exactly, yeah, you're right.
So this is a little bit of a different ballgame, and that's why DOHC offers this workshop that really helps people identify, because you assess healthcare needs, surgeries, chronic conditions, all of those play a factor in determining what your coverage needs are and might be.
For the following year, absolutely. So during open enrollment, right now, October 15th through December 7th is the time for people to come in and learn about what options they have and make sure that they're selecting the plan that gives them the best health care for the following year.
And each year you revisit this because your healthcare needs change year to year.
I wish we could just say one and done, but you can't. You really need to be doing these reviews every year.
And for those folks who are working past 65, sometimes it does pay to go ahead and look at Medicare. It might be a less expensive option than your private healthcare choices.
Exactly, absolutely. That's a great point. Some people have to pay a lot out of pocket for their health insurance. Medicare may be a less expensive option for them.
Thank you, Melissa.
You're welcome.
You can call 760-320-8814, and the extension is 1502 or mydohc.com.
Thank you.
And it's confusing, and it can be.
But we're here to help.
They're here to make it a lot easier. Thank you very much.